this is, Dr. Martinez really epitomizes what we're all about. He spent a lot of time with the patients, and he gives them really, really good face time, and he really, really cares. He follows along the lines of my sister and myself, my dad, what we set up. And it's truly dually diagnosed treatment. I mean, we are really doing it now, ever since you've been here. So that's all I've got to say.
Thanks. So, I'm Dr. Jeremy Martinez. I'm a psychiatrist. I specialize in addiction. And I am a consulting psychiatrist here at Pasadena Recovery Center. The reason that I wanted to talk about this topic, this idea about painkillers and kids, and I use the word kids very liberally, you're pretty much a kid until you're 30, in my mind. Some people even later. Along the lines of what Mike was saying, this talk in particular I think is important because it does put a face to this problem of opiate addiction, and that's really my goal, is to really kind of get into the mind of the person who's struggling with opiate addiction. So I first became interested in addiction really when I was in high school. I had a good friend who was addicted to cocaine, and he really had a hard time getting off of it. And ultimately what he did was he used methamphetamine to taper himself off. So he devised his own detox and was able to switch to a different drug, taper himself off, and he quit. And I always thought that was really, really interesting, that this idea of this cross tolerance between different drugs. And it wasn't at that time that I decided to go into the world of addiction treatment, but that was something that sparked my interest in how these drugs affect the brain. But this idea about cross tolerance between how you react to one drug versus another and how they interplay together is important in this talk. So in terms of any financial disclosures, I am consultant here, and then I also am working under a grant by the Healthy Family Foundation at another site, St. Joseph Center for homeless addiction treatment. But no, I don't have any pharmaceutical interest or anything like that. Okay, so this case is based on a real patient. This isn't his picture and it isn't his name. So, and I've also changed some of the details of his story, so I don't think that there's any confidentiality problem. But so Dave is a 22-year-old guy, UCLA student. He wants to become a doctor. He's pre-med. He grew up in San Marino, California. Good family. Lived with his mother, his father, grandmother. Very active in his church. And growing up, from what anybody could tell looking at him, he was a really good guy. Maybe he was a little bit too driven, really interested in school, really focused on his grades, but no major faults. But ultimately, Dave runs into trouble. His parents receive a call from LAPD, and he's been arrested for trying to purchase heroin from an undercover police officer. Now, this is something that nobody had any idea that was going on. This good kid, how did he end up using heroin? And turned out he was using IV heroin. How is that possible? This good kid from a good family, etc. Well, these things happen, and this pill here is one of the problems, one of the gateway drugs into opiate addiction. Does anybody recognize what this is? Yeah, that's Vicodin. So here Dave was, good kid, But really, do you think that addiction can, discriminate between, based on your personality or your upbringing? I mean, can a good person use drugs? I mean, I think it's an important question, because we often see addiction as this moral issue. This is a bad person who uses drugs, or this is a good person who's sober. But really, this issue of prescription drugs is bringing in a lot of people into substance use that, by a means that they might not otherwise have developed an addiction. So for him, when he was 16 years old, he first tried Vicodin. A friend from his youth group had some pills. A friend had a skateboarding accident, had a surgery, got pain medication. I actually never took the medication for his injury, but just kept the pills around. And one day after school, they decided to try taking the pill. And they kind of enjoyed it. They kind of laughed at how each other was talking, and they didn't really see it as a big deal. Now the reality is, this type of drug use, these prescription painkillers have been on the rise, and have just continued to increase. And if we had a more recent chart, it would increase even more. And one of the issues with something like Vicodin is that it's often seen as safer than a street drug. It's a prescription. How bad can it be? The doctor prescribed it to this kid. How could it really harm him? The kids, these were kids. They knew each other from church. They didn't see themselves as using drugs. This was just something to do, and it seemed fun. But one question is, did this become an addiction right away? I mean, how do these things happen? Do you think people take a couple Vicodin and then become addicted, or how does that play out? How long does it take? Well, the fact of the matter is, with this young man, he didn't exhibit any signs of addiction right away. But one thing that did happen was that he had this deep down feeling that the pill somehow made him feel a little bit normal. That something in him just wasn't quite right. So kind of like this picture of these, two sons. Something was just a little bit off, and he felt like that there's something deep down that this pill made him feel a little bit more normal. So Dave was often overstressed. He had symptoms of intense worry, problems with concentration. He did get irritable at times, put a lot of focus on his schoolwork and what he was studying, very concerned about tests, would overstudy, had a lot of tightening of his muscles, muscle tension, which is a sign of an anxiety problem. And people that do have anxiety problems tend to get easily fatigued at the end of the day. The intense muscle clenching leads to tiredness at the end of the day. Also had some problems with sleep, feeling wound up. And all these symptoms are symptoms of a psychiatric disorder. Anybody know what it is? Yeah, generalized anxiety disorder. So it's not only mental, but it's also physical. And not everybody who has these symptoms necessarily has a disorder. The big difference between what is just having anxiety, what is just worrying and not being able to sleep because you're worried about tests, versus a disorder, the difference is in the functioning. When the anxiety becomes such a problem that the person can't go to work, when they're staying home because they're so tired from not sleeping, they aren't able to concentrate, and they do poorly on their tests because of the worry. So that's really the difference between an anxiety disorder and just anxiety in general. But anxiety be it a disorder or not, is something that's really common among people who start getting into trouble with opiates because the opiates make them feel better. So with Dave, he didn't have any regular drug or alcohol use. His high anxiety actually in some ways was helpful for him. He tended to perform well in school, worried a lot about his grades, worried a lot about his family, always wanted to be close to his family. And when he got into UCLA, he decided to live at home because he was so worried about his grandmother and his parents, and it made him feel more close being close to the family. So, after a couple of years, he wasn't really using any opiates regularly. Him and his friend, they took these pills once a month, once every 2 months, just as much as whatever was left in the bottle. And it didn't really become a regular thing. But then something happened. And Dave gets his wisdom teeth removed. So his dentist wanted to treat pain, which is a big issue in medicine. If any of you have heard talks in general internal medicine or in pain management, there is a big push toward this idea that we undertreat pain. So there's a big push to treat pain appropriately. And so the dentist, wanting to treat pain, maybe he just come from a conference or something, gives him 120 pills of Vicodin plus a refill. It's a lot of pills. He does take the medicine for pain, but he feels a little bit more calm when he's taking the pills, and he kind of likes it. He finishes the whole prescription and he gets a refill. Overall, the medicine lasted him a little over 3 months, and it was 2 refills, so it should have been only for 2 months. So he felt like he wasn't really taking that much, and it was prescribed for him. So it didn't really seem like a problem. But eventually, medication runs out. And then, what happens? Yes. So there's a lot of anxiety that happens right when people run out of their medication, right when they run out of opiate medication. And what else? What happens when somebody runs out of opiates? They get sick. Yes, so that's a term that you commonly hear people using, this idea like I'm sick. Opiate withdrawal has symptoms of nausea, vomiting, diarrhea, just feeling very uncomfortable, and it's like having a flu, but a very bad one. And so people are desperately afraid of getting sick. So this is a cycle that we tend to see. Persons using opiates, they feel like they're okay while they're on opiates. They may or may not be getting high. Person who's starting out with opiates, typically it's more using the opiate and getting high from it. And once they're physiologically dependent on it, they start to have withdrawal, this getting sick. And the idea of this panic, the anxiety that happens, even before the symptoms of getting sick, is the anxiety of knowing that they're going to get sick, which is a big problem. And it leads to this continued use. Once someone's physiologically dependent, most people that you talk to who've been on opiates for a long time, it's not so much using opiates and getting high, but using opiates and getting low. So avoiding getting sick, trying to get back to their baseline so they can get to work, so they can do the things that they want to do. With this patient, he was in school. He was taking his medications. He was in college. He was doing his pre-med classes, and he was functioning. But once he started realizing that when he ran out of them, he got sick. He got freaked out. So where do you think he got his pills next? He ran out of this prescription, then where did he go? Grandma. You got it. He went to Grandma. So Grandma had a prescription for pain medication. She had lots of pills, and they would get sent every month. Whether she took them or not, she was on the you know, the healthcare plan where they like to just keep sending you pills and call your doctor when you don't have medicine, and the doctor refills it because it's annoying. You get lots of phone calls, and that's what happens. So, you know, Grandma didn't need these pills, and so Dave found his new medication. What is this? Oxycontin. Yeah, so this is a 20 milligram Oxycontin. You'll notice the OC on the pill, and that's important because we'll talk about that in a little bit. But this is what he began taking. He began taking his grandmother's medication. She had tons of it. It was a prescription, and he felt justified in taking it. It helped him continue to go to class and kind of helped with his anxiety, and he felt better. So Oxycontin is extended release oxycodone. So it's a little bit different than Vicodin, which is hydrocodone. Oxycodone tends to be a little bit more potent. When we're prescribing it for pain, it tends to be for the more severe pain. It's taken by mouth, but people also crush it and they'll snort it, they'll smoke it, or people will even shoot it sometimes. But for Dave, he was just taking it by mouth. He was taking it once a day. It's an extended release pill. It seemed to work well for him. He liked it. And everything was fine except that it didn't seem to give him the effect that he wanted after a while. So while he's in college, he meets new friends, meets some college kids that wanted to smoke marijuana. They were talking about different drugs, talking about smoking Oxycontin, and just turned out that he had Oxycontin. And a friend says, well, we can, you've never tried smoking it, you've only taken it by mouth. It's much better if you crush it and you smoke it. So that sounded good to him. Turned out that the 20 milligram dose was a little bit more potent when he smoked it, so he kind of felt a little bit better. And soon it was beginning to escalate, started running out, and the grandmother's medication wasn't enough to hold him over. So eventually, a friend was connected in the black market where he got his pot and started to get the 80 milligram Oxycontin, which is the dose that most people prefer on the street. That's the most commonly sold dose. So he starts smoking the Oxycontin daily, and at this point he knows that there's something bad going on. He knows he shouldn't be doing this, but the fear of the withdrawal is so intense that he just is trying to keep himself well, hope that he can get through school and not have any problems. His family knows him as a good kid, and he's not at this point about to tell them what he's been doing. But he's been able to maintain his grades. It's very seductive. He feels like he's, maybe he can do this and maintain. At this point, he's starting to smoke about 120 to 160 milligrams of Oxycontin every day. But that starts getting very expensive, especially when this happens. And I don't know if you can see this, but there's different letters on the pill. Can you see what it says? OP. Yeah. So what's that? Actually, that's initially when I heard patients talking about OPs, I thought they were talking about Opana also. But it turns out this is the new version of Oxycontin. Purdue, the company that made Oxycontin, became aware of the abuse potential of the Oxycontin. They created a new formulation that is more difficult to crush. So that's the OP formulation. So harder to crush, but it also led to increased street value of the OCs. So what you can see here is the street price. And something that I always like to look at with drugs of abuse is look at their street value, because it tells you a little bit about what's going on with the drugs. What do people see as the good stuff? It follows supply and demand just like anything else. So the old Oxycontin on the top line started rising in price up to $2.50 per milligram. remember that the 80 milligram is the most popular dose. So this becomes very, very expensive. And the new formulation of OxyContin is still being sold on the street. People take it by mouth, but it's a little bit harder to crush. People have tried different things, but I think the company did a decent job of trying to prevent that. But for people who were using OxyContin at this time, it became very, very difficult for them to continue their habit, and they started to go into the same concerns that they had, the withdrawal. And so with Dave, his 160 milligram a day habit of OxyContin turned into a $400 a day habit. And so he went back into this cycle of, just trying to get enough to feel well, plus or minus getting high at this point. Getting high wasn't really, a possibility. It was more just trying to prevent the withdrawal. Waking up, anticipating withdrawal, trying to get medication so that he can make it through his day, and just hope that he doesn't get sick. So Dave starts to look for alternatives. He also started self-medicating with Xanax. And Xanax is a sedative, a benzodiazepine. It's one of the most common benzodiazepines that are sold on the street. The UCLA fraternities became a good source for getting drugs. They were buying and selling all kinds of things. And so he started using Xanax because it was a little bit cheaper, about $5 a pill, and got up to about 12 milligrams a day with that. So for this person, he already had anxiety, and an anxiety medication like Xanax also helped him to feel better, so he liked it, but it also has this cycle of going through withdrawal and having problems. So ultimately, it just wasn't feasible for him to continue with OxyContin anymore. And heroin is something that was decreasing in price. It was also decreasing in quality, but it was greatly decreasing in price during this time, and it became a much cheaper option for him to use. With the equivalent of what he was taking, it would cost about $80 worth of heroin versus $400 for OxyContin. So, at some point it made sense. Now, the seductive thing about heroin is that it can be smoked. So, here's this kid that came from a upper middle class background. He never really thought of himself as, an IV drug user. He wasn't really exposed to that. But he had smoked pot, he had smoked the OxyContin, and smoking heroin didn't seem like such a jump for him. And it was a lot cheaper. He was able to avoid the withdrawal. And he started smoking about 1 gram of heroin a day. And that was a lot more cost effective. But as time went on, his tolerance continued to increase. He went from 1 gram a day to 2 grams to 3 grams a day. And all of a sudden, even smoking the heroin became very expensive. So trying to support this habit, again, just trying to stay well. Waking up, knowing that he had to go to his organic chemistry class, so he wanted to smoke his heroin so that he wasn't having diarrhea during class, so that he wasn't having this intense anxiety and muscle cramping and nausea. Kind of, at some point thought maybe that he could get by doing it this way, but it became expensive and the same problems developed. So at this point he really wasn't getting high anymore, and in order to continue his habit, began dealing the heroin, because that was a way to make sure that he always had a supply, and a way for him to make money, because at this point any money that he had saved up for college was gone at this point. So what happens at this point? Somebody's smoking heroin, and then that becomes too expensive. Yeah. So IV heroin is about 2 to 3 times more potent than smoking it. So for that same, to get that same effect, rather than spending over $200 of smoked heroin, he went on to IV heroin at about $80 a day. He also continued to use the Xanax. And Xanax and medications like that also potentiate the effects of opiates. It makes opiates more intense. So that's one of the reasons why at methadone clinics, there's always people in the parking lot selling Xanax, because it potentiates the effect of their opiates so that they're feeling it more. So they're going from that trying to be well to trying to get high. So, at this point, he starts using IV heroin. He knows that he needs help, but he's thinking, how, at this point, can I really tell my parents or go into treatment? I mean, here I was like, okay, maybe when I was taking Vicodin, I could have gotten treatment, but at this point, I just don't know what to do. And the only option is to just keep doing it and try to keep myself well so I don't get sick and try to get through school. But then he gets arrested. And this ends up being one of his rock bottoms for him to ultimately get treatment. So there's a few issues here that are important to look at. The first one is an undiagnosed anxiety disorder. This was somebody who, he had a high level of anxiety. Sometimes it was functional for him, where it actually pushed him to do better in school, but doing well in school almost became like an obsession to him. He was overly concerned about it. He was overly worried about his family. He never sought any kind of treatment for that, but it was a huge problem. And once he had the opiates in his system, he started to feel a little bit better. So that was one of the things that led into this problem.